work? Are they going to take over the hospitals? Let's get some perspective and answers from Pentagon Press Secretary Rear Admiral John Kirby. Admiral, always a pleasure. Thank you for joining us.
Good morning. Good to be with you, Chris.
So what is the answer, Admiral? Is this team going to replace, or are they going to aid? How will it work?
This team is really to be an assistance to help civilian medical authorities where and when they're needed. So they're going to start training here, we hope, within the next week or so. That training will take about a week or so, and then when they complete that training, they'll be on what we call prepare to deploy orders for about 30 days, for about a month. And they'll be responsible for being ready to go at 72 hours notice or less.
One person in charge, Ron Klain. Is this something that is outside your pay grade, or can you tell me if you think this is a good idea? Does it help the situation?
Well, we don't make policy here. We execute it. I mean, we're going to do whatever we can in the Pentagon to support Mr. Klain and his efforts, as we are right now in supporting the interagency effort against Ebola. In fact, this request for this team was a part of a discussion that Secretary Hagel had with Secretary Burwell at Health and Human Services, and they decided they needed this capability, so we're going to provide it.
My understanding is that the Quick Strike Force had been on the table and suggested by you all at the Defense Department very early on in this process here of cases coming to the United States. Is that true?
Well, I haven't heard that it was part of the discussion very early on, but what I can tell you is that from the very beginning, Secretary Hagel's been very clear that the United States military has unique capabilities, things that we can offer and provide, and he's made it very clear to all the leaders in the government that we're standing by and ready to provide those capabilities whenever we can.
How's it going in Liberia? Has anyone contracted the virus that we don't know about? What do you think the progress is?
No, none of our troops have contracted the Ebola virus. None of them have shown any symptoms. It's going okay, and okay, I mean that we're on track to get those first emergency treatment units up. The first one will be done by the end of this month. The second one probably the first week of November. We're building the training site. It's going okay, but the weather and the infrastructure is still a problem. I mean,
right.
It still rains much of the day, and it just slows us down a little bit. But our troops are working really, really hard, and they're very proud of the contributions that they're making.
And now I know that Ebola doesn't move in water necessarily, or at least they don't understand it that way, but a wet environment is obviously something of concern with something that is a wet virus. Let me ask you something. There's a headline, Nigeria now Ebola-free. They haven't had a case in a certain amount of time, and that is what qualifies it. People take that news and say, well, if Nigeria can do it, certainly, you know, the U.S. forces can get that done very quickly anywhere else. How hard a challenge is that?
Well, it's still going to be quite a lift. I mean, this disease is very, very deadly, and it's spreading down there. There's no question about that. I want to make sure that I may be clear that the U.S. military is not coming to the rescue here all by itself. Mm-hmm. We're providing some unique capabilities, but we're a supporting element to USAID and the CDC, as well as the government of Liberia. There's an awful lot of people down there, healthcare workers from non-governmental organizations, as well as governmental organizations that are doing a really, really, really good job trying to get their hands around this, and we're just there to support them.
Headlines from the other virus that we're attacking called